Hi everyone, did you know nurses are an integral part of the healthcare system, providing critical care and support to patients during their stay at the hospital? While they are highly trained professionals who are dedicated to their work, there are certain things that nurses keep to themselves that patients may not be aware of. Here are 10 secrets of nurses in the hospital that patients don't know. They have to deal with difficult patients. Nurses often have to deal with patients who are rude, demanding, or non-compliant. While they try their best to remain calm and professional, it can be emotionally draining to deal with difficult patients day in and day out. They have a lot of paperwork. While nurses spend a lot of time with patients, they also have to deal with a lot of paperwork. This includes documenting patient care, medication administration, and other important information that needs to be recorded. They work long hours. Nurses work long shifts, often 12 hours or more at a time. This can be physically and mentally exhausting, especially when they have to work multiple days in a row. They have to deal with bodily fluids. Nurses are responsible for cleaning up bodily fluids such as blood, urine, and feces. This can be a messy and unpleasant task, but it's necessary for the health and safety of patients. They have to deal with death. Nurses often have to deal with the death of patients, which can be emotionally difficult. They may have to console grieving family members or deal with their own feelings of loss and sadness. They are always learning. Nursing is a constantly evolving field, and nurses have to keep up with the latest research and best practices to provide the best possible care to their patients. This means they are always learning and improving their skills. They have to work in a fast-paced environment. Hospitals are busy places, and nurses have to work quickly and efficiently to provide care to multiple patients at once. This can be stressful, but nurses are trained to handle the pressure. They have to advocate for their patients. Nurses are often the primary advocates for their patients, ensuring that they receive the best possible care and treatment. This can mean speaking up on behalf of patients who are unable to speak for themselves. They have to deal with difficult doctors. While most doctors are great to work with, some can be difficult or demanding. Nurses have to navigate these relationships to ensure that patients receive the best possible care. They care deeply about their patients. Despite the challenges and difficulties of the job, nurses care deeply about their patients and want to provide the best possible care to them. They often form strong bonds with patients and their families, and it can be emotionally rewarding to see patients recover and go home. In conclusion, nurses play a critical role in the healthcare system and work hard to provide the best possible care to their patients. While they have to deal with many challenges and difficulties, they remain dedicated to their work and care deeply about their patients.